Well, Gerald Quigley, I am a very excited person.
Contain your excitement, John, but it's good to see you.
Gerald, the reason I'm so excited is Gerald and I are embarking on what can only be described as a very, very amazing adventure, and it's called If Pain Persists, and it's the podcast.
I think we call it these days, John, the journey.
Oh, the journey,
yes,
of course.
It's a very important word.
Yeah, right. Now, Gerald, give me your credentials. I think it's important we alert our listeners to your credential. You are a community pharmacist?
Yes, which means I work
in the community.
In the community, helping people with their medicines, their medications, their nutritional suggestions. Community pharmacists, essentially, are the people that work in the store up the street, and they are there to give advice for anybody who needs it, to perhaps direct them to a doctor if necessary, advise them on their medications, bring together all the different aspects of their health, and more especially, they are the guardians of it's hard to say it in a phrase, but we're supposed to be the guardians of medications.
Okay, all right. That? You're the go-between, as it were,
if you like,
between doctor and patient.
We're part of the conduit, but we've got to remember the patient, our patients, the people we look after. They're at the centre of a wheel, and all around the wheel are the various people who have input into their health.
Right. Okay. Well, that answers my question about what is a community pharmacist. I wasn't expecting it to be so long, Gerald, but you're also a master herbalist.
Yes, I've enjoyed practicing, and I'm starting to get it right, for about 30 years, John, of Western herbal medicine. So these are gentle remedies which rebalance. So if you have a cold, you can go down the medication pathway. You can try and fix all the little bits and pieces. But why not put into place some gentle remedies to minimise your risk of getting a cold in the first place?
Okay, that's the definition of a master herbalist. You're also a media health commentator. Now, I can vouch for Gerald here because anytime any current affairs programs want expert advice, you see his beautiful countenance popping up on television shows all over the place. Media health commentator.
I enjoy doing my bit to perhaps demystify.
You enjoy the limelight. Tell the truth.
No, well, there's not a lot. Look, all right. Yes, I do. All right.
And you're also an author. Now, I haven't read any of your books, Gerald.
I have one book.
One book. Oh, dear. That's very sad. Does it have pictures?
It has drawings and has some photographs.
Yes, okay.
No, they, I suppose, could be classified as pictures. It actually is all about the benefits of olive leaf extract.
Now, does Olive know you've published a book about her?
No, not yet. No. But one of these days she will find out. Olive leaf extract, I've got friends in Greece and they tell me that wherever you go, there's olives and things there. But olive leaf extract is from the leaf of a particular species of olive tree. Of which there might be 400 different types.
How many pages in this book?
I think from memory about 75 or
75, but you call that a book?
It is a book.
It's a brochure. Tell the truth.
It's got a slightly firmer cover.
Yes.
So it's getting towards a hard cover.
All right.
But I found if you actually paint it with water and sit something on it, the cover goes hard.
Now, so you are a published author. Where can our listeners buy this book, I put in inverted commas?
Well, actually, the facility is that if you buy this particular extract of olive leaf, the e-book comes free.
Oh, I see.
It's a free e-book.
Well, you're not going to make a lot of money out of that, my friend.
No, it's not all about money, John. It's about making a difference to people's lives.
Quite right.
Yeah, but John, enough about me. Tell me what you do.
Well, just about nothing, really.
Well, other than doing nothing, what do you do? I know.
I'm sort of. They call me the master of the quick quip and the quick ad lib and the one-liners and all that sort of stuff. But I'm sort of a media personality, worked in radio and television for close on 47 years. But at the bottom of it all, I'm just a professional smartass.
Well, there's nothing wrong with that. Now, what I've got to do, so my role in this journey is basically to give information to people who are enjoying these podcasts to keep you under control.
And my role is to ask... I know nothing about pharmaceuticals or health issues, but I will ask many dumb questions, which Gerald will attempt to answer over the next few podcasts.
We'll try.
We'll do our very best anyway. So that's sort of my role, all right? Our producer has spared no expense, Gerald, in producing this podcast. He has imported a voiceover lady, and her name is Toots Galore.
I see.
And you're about to have a listen to it. Here's Toots. You ready? Yes, she's nodding. Here's Toots to officially introduce the first ever podcast of If Pain Persists. Take it away, Toots.
Hi Hi there, and welcome to our podcast, If Pain Persists, hosted by media legend John Blackman and Gerald Quigley, pharmacist and master herbalist. If this is your first time listening, thanks for dropping in. There's plenty more to come. These podcasts are all about avoiding pain, keeping healthy, and enjoying life. Visit our website, ifpainpersists.com, where you'll find all our podcasts and you'll be able to post questions about your health on Gerald's blog. You can also follow us on Facebook and Twitter and subscribe to If Pain Persists on iTunes. It's free. Now, let's get on with the show.
How about that, Gerald?
Very good, John.
She's not too bad. You can stay, Toots. She's in the other in the control room there and giving us a thumbs up.
What's that signal?
Well, actually, she's not using a thumb. She's using a finger. But anyway, look, okay, now, today's topic is, Gerald.
Yes, John.
Our very first topic.
We're going to be talking, If Pain Persists is the name of our podcast series, but we're going to be talking about generally today pain. If there's one thing that I would love to be able to wave a magic wand across and help the constant line of people who I see, is to help them bring their pain levels under control so they get quality of life back. They begin to do the things that up until perhaps a few years ago they were doing just as a matter of course. Going to golf, going to bowls, picking up the grandchildren, going out, going for a walk for
picking
half
up
an
the
hour.
children.
Picking up the children.
Yeah, let's not discriminate
No,
here, Gerald.
pain levels do affect lots of different ages.
All age groups, all demographics.
Yes, they do.
And it can be so distracting too, I find. I have constant pain in, as you know, in both my big toes. Some people call it gout, which we'll talk about in another podcast.
We will, because there are reasons why you have the gout, but let's keep that for another time.
But pain is, I mean, everybody has pain of some sort or another, don't they?
Everybody. Well, you look at babies have pain, they have teething pain, they have colic pain, all sorts of things. And we learn to live with pain, but most pain, hopefully, comes and goes. So you deal with it when it arises. And that's called acute pain. So if you whack your finger with a hammer, it hurts like blazes, that's acute pain, but over time it will subside.
And not only that, it's not cute either when you get your...
No, it's not. But if you kept whacking it every day, you're going to cause chronic pain because you're going to deform the joint.
Yes.
You're probably going to increase your vocabulary for a while as well.
Yes.
But that pain then...
Especially in the expletives area.
That pain becomes constant. So every time you touch your thumb on something or you go to pick something up, you're going to be reminded of that pain. That's chronic pain. And that is one of the most difficult issues that as we age, and we're all getting older, and I'm looking at you especially here, as we...
I've been ill.
As we age, pain levels tend not to come back to normal. They are really ongoing. So you wake up feeling a bit stiff and sore and pain. You cope with that during the day. Every time you sit down, you might find it difficult to get out of a chair. You'd love to do activities A, B and C and you can't. You go to bed in pain at night. You wake up to go to the loo in pain, and it just is wearing day after day after day.
And pain has pain always been it's always been a huge factor in the quality of the lives of our ancestors too, hasn't it, Gerald?
Yeah, but we live longer. Now, pain to them was coming out from the Blackman cave in that street that your ancestors way back lived. Grabbing or hunting and killing some food, and then really going back to normal. So their stress levels, which is a different topic which we'll talk about soon, their stress levels would tend to subside. So if they got injured, they were able to take time to recover. The challenges of living longer these days is that those constant stressors and things that wear us down, food choices, these things are with us all the time and they add to that inflammation.
So what effect does stress have in pain, Gerald?
Huge, John, huge. We're lucky that you and I are relatively stress-free, but there are lots of folk who live with the stress of pain. So the pain causes the stress causes the pain, and it's just a cycle which is ongoing. And unless you get in there and interrupt that cycle somehow, and that might be with medications, might be with herbal supplements, it may be with some psychological counselling, maybe with a dietitian, maybe with a physiotherapist. There's all sorts of issues that can impinge on lowering pain levels.
Right, okay. My psychiatrist tells me I don't suffer from stress, but I am a carrier. Okay, so that's a very bad joke, and I do apologise. But in general terms, Gerald...
Yes, John.
In general terms, does a person in pain therefore get more pain in stressful situations?
Yes, it does, because one causes the other. If you're in pain, you don't sleep.
Right.
People who don't sleep have a lower threshold of pain. So they feel pain, that awful four-letter word, constantly. It never leaves them. It's like a cloud that follows them around. And that's really a description that sometimes people tell me.
Well, Gerald, can we cut to the chase here? In general terms, what medicines are used in the treatment of pain, apart from the obvious ones, the ones that...
Your favourites.
My what?
Your favourites.
My favourites.
The non-steroidal anti-inflammatories.
The non-steroidal anti-inflammatories, which I take before golf to prevent pain. Or does it prevent pain or does it mask it?
Well, you tell me it's performance enhancing, and it's not.
Yeah, but it masks
won't improve your golf. Yes, it masks it, which may or may not be good, because it means that you might be overdoing a painful joint and you're not aware of it. You may be causing more damage.
Okay, all right.
If we start at the bottom of the rungs of the ladder, the simplest, John, is probably paracetamol.
Yeah.
Now, everybody's got paracetamol, but it comes with a few little issues. It can, in large quantities, be toxic to your liver.
Yeah.
I know your liver struggles at the best of times, but you put paracetamol in there and it makes that risk to your liver much worse.
I find cask wine is toxic to your liver as well.
It certainly is. Yes. Well, it is, and you shouldn't go near that. No. So these paracetamol... Now, as you come up the tree, paracetamol sometimes has codeine added. Now, codeine is a relatively mild opioid.
Listen, what is the difference between an opioid and an opiate?
An opioid is an opiate-like medicine. So an opioid is the derivatives of the opiates.
Yeah.
So we're looking at morphine and pethidine and those things. So codeine is is the derivative. It's almost like a prodrug, and that in our body gets changed to another active metabolite.
I only asked Gerald that because he knows so much stuff, and he never gets a chance to show off.
And if we move further up the rung, we might have a non-steroidal anti-inflammatory. Some of those are available without prescription.
Right.
Either alone or combined with paracetamol or combined with codeine.
Like those non-steroidal anti-inflammatory things that I get over the counter, and the pharmacist always asks me.
Yes, he should. That's his professional responsibility. And I know you tell fibs.
Hang on, how come you're always assuming pharmacists are he's?
He or she will always ask you...
Just be very aware, Gerald, we have a lot of politically correct people listening to this podcast.
They will always ask you the appropriate questions because... They need to know that you don't have blood pressure, which you do.
Yeah.
They need to know that whether you're going to be driving or not, which you do.
Yeah.
So you take these things anyway, which is not very responsible.
What happens if I lie? Because I'm so, addicted to these non-steroidal anti-inflammatories.
No, you're not addicted to them. They're habituating.
Yeah.
You're in the habit of taking them before your activity.
But I mean, what sort of effect could that have on me if indeed I do have blood pressure problems?
Your blood pressure could soar.
Oh, really?
Yes, because it interferes with your kidney function.
It soars when I miss a 1-foot putt.
No, that's your temper levels. Of course, no, all of that. Well, but you see, you don't want to really challenge your blood pressure. So you won't take any notice of what I say, but you just need to be careful.
Yes, all right, okay.
So further up the tree, though, then there's the opioids. So there's morphine and there's oxycodone, and they are very, very powerful. I
love morphine. By the way, am I allowed to say that?
Well, you had it during your anaesthetic.
No, I had it when I had a kidney stone, which was highly painful.
I remember. I could hear your screams actually from suburbs away.
So I'm going to give you some morphine, Mr. Blackman. Are you allergic to it? And I said, well, I don't know till you've actually given it to me. She said, anyway, this will just ease the pain. What a wonderful drug morphine is, Gerald. Can I say that?
Well, you've said it now. So,
right,
under medical supervision in the short term, it does relieve pain.
Now, Gerald, you being a master herbalist, can I ask you this question?
Yes, please do, John. You're going to ask it anyway. So
there are so many natural medicines advertised as effective for pain. Now, are they effective, or is it just great marketing?
No, they're effective, but they've got to be used properly, and there are lots of different extracts. Now, when you and I have a cup of tea, you'll have a English breakfast, I'll have an Earl Grey, a French Earl Grey, but there's still tea.
Sugar?
And no sugar.
No sugar.
And it's the same...
Salt?
No salt. It's the same in herbal medicines.
Milk?
No milk.
No milk.
It's the same in herbal medicines because you've got to make sure you get the extract that's got the clinical evidence to support the claim. And that's where you need to do a bit of investigating. You need to ask someone who is happy to give you the response that
Sure.
is appropriate. And then you need follow-up. So you need to go back to that person, either he or she, and say, yes, it's working well or not. So various adjustments can be made.
All right, okay. And another question too, Gerald, without notice, can you mix prescribed medicines with some of your natural ones?
Yes, you can, but you need advice on how to do it. But usually most are very safely able to be integrated into the medical regime.
Yeah, because they're quite, in a way, quite harmless, aren't they?
Harmless is not the word. Even though they're natural and they're normal, they're not harmless. They have a therapeutic action. But from an adverse risk profile, the adverse risks of a herb like curcumin or turmeric is a fraction of what the risks associated with an opioid are.
Right.
So if you look at risk versus benefit, I know where I'd rather be.
All right, Gerald. Well, I think we've touched on as much pain as we possibly can. And looking at the producer's face, yes, he's in pain. He's giving us the wind-up here. It's time to wind up our chat about pain. But we will come back to pain in later podcasts because it is very, very much an all-encompassing ailment that people have.
You put pain at the top, John. There's gout, there's migraine, there's colic. Most things have a pain component. And over time, we'll talk about all of those, but really we would like your feedback on what you would like us to talk about.
All right, okay. Until next time.
Thank you, John.
And here's Toots just to take us out. Thanks Toots.
Thank you for listening to If Pain Persists. This podcast is hosted by John Blackman and Gerald Quigley. Remember to visit the website ifpainpersists.com. This is where you'll find show notes and you can ask questions about your health and well-being on Gerald's blog. And you can follow us on Facebook and Twitter. Stay tuned and subscribe to If Pain Persists on iTunes. It's free. This show is produced by Meaty Man Productions. Until next time, stay healthy and happy.